Sorry, your hands. Okay, ready? Okay, good morning. My name is Chen and I'm a student nurse. I'm here to assist you today. How are you?
I'm good, thank you.
That's good to hear. Could I ask what you're in for?
Just a general health assessment.
Okay, that's something I can assist you with. I just need to confirm some details. Could I start off with your name, please?
Chester Abioye.
Yep, your date of birth.
14th of January 2000.
And your current address?
97 Leafy Avenue, Broadfields.
Okay, I'm just going to read your previous patient notes. I'll be right back. Okay, thanks for waiting, Chester. So I was looking at your vital signs and all of them except for respiratory rate were in healthy range. Are you familiar with vital signs?
Yes.
Okay, did you know your respiratory rate was higher than the normal parameters?
Yes.
Okay, that's good. Okay.
Which is why I want to become more healthy, so I'm here.
Okay, that's good. That's good. So, your objective for the health assessment is to be healthier.
Yes.
That's good. So before we get into it though, I just want to make sure you're comfortable because it could take a few minutes. So are you comfortable with doing it here?
Yeah.
Yep. And just making sure you're comfortable with me recording the information you give me.
Yes.
Thank you so much. Could I start off with by asking if you have any allergies?
No. Not that I know of.
That's good. And if you have any medical history you'd like us to be aware of?
I used to struggle with depression, but it has not affected my life.
That's good.
In a while.
That's good. That's good. But could I ask if you had any medication for it?
No.
Yeah. And what was your method of rehabilitation?
I came up, my psychologist and I, we had a mental health care plan.
Okay. That's good. And cultural background?
I'm from Zambia.
Mm-hmm. And how long have you been here?
I came last year.
How was the transition?
It was very stressful. You know, I do feel lonely. Everyone I knew was left behind.
Yeah. Okay, that's something we'll definitely touch base with. And do you have any religious practices you follow?
No, I do not.
Okay. So, you did mention you're coming in here for a health assessment, yeah, and it sounds like one of your goals is to have healthier habits, if there are any that we can improve more on. But with the health assessment, we can also discuss concerns. And you've mentioned that you've been feeling lonely, is that what you said? And that the transition, that was a big part of it. Is there anything else you want to add to it?
Stress and being more active.
Yep, absolutely. Okay, could I start off by asking your living arrangements?
I live with 4 other housemates.
Yeah? And how is that?
It's a little cramped, but it's fine.
So you guys get along, and it's not any source of toxicity, so to speak? That's good to hear. Could I inquire about your diet?
Usually bread, meat, rice. Not a lot of vegetables though, I will admit.
Okay. Is that something you'd be open to increasing just because of the health benefits vegetables and fruits do provide?
Yeah, I guess I could add a little bit of vegetables.
Yeah, absolutely. You know, we can start with some baby steps, experimenting, you know, having a fruit in the morning, maybe a snack in like the day, and having a bit more for dinner.
Yeah.
Does that sound doable for you?
Definitely.
Yeah. Okay. So, do you mind if we touch base with that maybe in whenever it's best for you, 2 weeks, 3 weeks, to see if it has improved for you?
Yeah.
Yeah. So I can write that down. Yeah. And while we're talking about diet, could I ask if you have any drinking habits?
I drink socially once a month.
Yeah. And what are your experiences with drinking socially just that once a month?
Usually, you know, just go all out.
Sorry?
Yeah, just go all out. Maybe go too far.
Okay, so when you say all out and too far, do you know how many drinks you're having?
Usually roughly 5 to 10.
And how are you the next day?
Not good. Headaches. I reek of alcohol. Feel like death.
Do you remember the night before?
No.
Okay.
It's a blur.
So when you say you go all out, you've actually pushed past your limit.
Yeah.
Okay. So just to put it in perspective for you, the recommended intake for alcohol in a day is at most 4 standard drinks.
Right.
And 10 standard drinks in a week.
Right.
So it does sound like reducing it. You don't necessarily need to cut out alcohol, but reducing it might be beneficial for you. So you're not experiencing, those mornings, but also you can remember and enjoy your night.
Yes.
So reducing alcohol, is that something you're open to? Yeah? Okay. So when we talk about reducing alcohol, what are you thinking? How many would you start off with?
Probably 6.
That's good. Yeah. And that's something we can follow up with, because you mentioned it only happens once a month. So, have you had that once a month yet?
Yep.
Okay, so when it comes up, that's something we can touch base on. And so is it okay if we go past your diet? Anything else you want to mention? Okay. Could I inquire about your smoking habits, if you have any?
I do. Around 30 cigarettes a day.
That is actually quite a lot. So to give you some insight, 1 cigarette daily can actually increase your risk of coronary heart disease, and 20 daily can increase the risk of stroke, especially even though you're so young, only at 21 years. It can also be possibly likely the cause of your increased respiratory rate.
Right.
Just because your lungs may be trying to compensate for that because of your daily smoking habits. Is smoking something you'd be open to reducing or even quitting?
Maybe in the long run.
That is understandable. We just make gradual adjustments. Do you think you might need assistance quitting smoking?
Yes.
Yeah. Okay. Do you have an idea of what the ideal assistance would look like for you, or is that something you want us to explore and discuss together?
Probably someone who can help me find a way to relieve the stress that I usually relieve from smoking.
Oh, okay.
Yeah.
So you're saying smoking is your reaction to stress,
Yeah.
how you manage it. Okay. So since we're talking about managing stress and coming up with more healthier outlets, it sounds like you're describing a psychologist, and you said you've interacted with them before. Is that something you're open to doing again?
Yep.
Yeah. Okay. So I can write that down, and you can discuss that further with your GP, getting a referral. Yeah. Yeah. We definitely do a follow up with that. Are you happy with leaving that for smoking?
Yes.
Yep. Thank you so much. And what are your exercise habits like?
Non-existent.
Okay, sorry. That's fine. Is there a particular reason?
I like spending my time more watching the TV or catching up with my family back in Zambia or with my girlfriend online.
That's right, and those are definitely important things to keep in our lives. Absolutely. So are you too pressed for time? Or do you think you could find time? Is it possible?
Yes.
Okay, so introducing some exercise, that'd be good. Is that something you feel like you need assistance with? Okay, so I can leave that, so the ball in your court, so to speak, and when we do another follow-up, I'll definitely ask you about how you're finding, introducing exercise on your own. And if you do need assistance, we can talk about it then. Yeah, does that sound good?
Yep.
Okay, so we did the health assessment, and we talked about different ways you can improve your current habits. We spoke about minimizing drinking or reducing it, reducing smoking, but also seeing a psychologist to assist you with the stress. But that could also assist in talking about addiction, and you gradually introducing exercise. Are you happy with the outcomes we've had so far?
Yes.
Yep. Okay, so I will get you the details of. Would you be interested in some smoking hotlines? Sorry, quitting smoking hotlines. Yeah, I can get that for you, and I'll pass on some of these things to your GP so that they can arrange your referral,
Yes.
and we can arrange a follow-up appointment if you'd like.
Yes.
Okay, we can do this. Let's go.
Thank you. Oh my.